treat severe dandruff? Dandruff, also known as seborrhea, is a common chronic condition of the scalp. It is actually a form of eczema that affects the areas of the body with hair. The scalp is the most commonly affected area, but it isn't always unknown to have dandruff on the underarms, the legs, the chest, or even the eyebrows and lashes. It isn't contagious or life-threatening, but it can be embarrassing and uncomfortable, especially during hot or very dry weather when the level of moisture in the skin drops. Dandruff is pretty easy to recognize. It appears as white flakes of oily-looking dead skin dotting the hair, and it may even shed the flakes onto your shoulders or face. People with weakened immune systems can suffer from severe dandruff. This includes people with HIV, those with neurological conditions, or patients undergoing chemotherapy. Severe dandruff can also affect some people who are completely healthy and practice good hygiene. If you are bothered by this troublesome problem, here are some tips on how to treat severe dandruff. 1. Severe dandruff is caused by skin inflammation, so treatment involves soothing the skin inflammation. Cortisone-based topical creams or lotions are generally recommended for this. 2. Although dandruff is not a yeast infection, like candidiasis, a fungus called Malassezia furfur is thought to make it worse. Some dermatologists would also suggest using antifungal treatments to control the yeast population on the affected areas. 3. Medicated shampoos that are especially formulated for dandruff can also help. These are mostly sold over the counter. Look for active ingredients like tar, salicylic acid, zinc pyrithione, selenium sulfide, and ketoconazole. You can use these shampoos every time you wash your hair until you see the severity of your dandruff beginning to decrease. Later on, you can reduce your use to just once or twice a week, alternating with ordinary shampoo for the rest of the time. Some patients say that switching between different brands of medicated shampoos seem to work better than sticking with just one brand, bottle after bottle. 4. If you notice that over-the-counter medicated dandruff shampoos or creams do not seem to improve your dandruff, then it's time to consult a dermatologist. Your doctor will be able to provide prescription-strength shampoos, cortisone creams, and antifungal ointments to calm down the itchiness and the inflammation. 5. Keep in mind that since dandruff is really a chronic condition, the best that you can hope for is to control it. However, for many patients, severe dandruff can be tamed so that it's not noticeable. There will be some recurring episodes of dandruff, but with a good maintenance regimen, it shouldn't cause too much trouble. Oftentimes, the only thing that you need to do is use a maintenance shampoo or cream at the first hint of a flare-up. Despite the fact that dandruff is fairly common, there are a lot of misconceptions about this condition. To set the record straight, dandruff isn't caused by the wrong choice of shampoo, hair care products, or antiperspirants. It also can't be helped by using conditioning treatments or moisturizing lotions. While moisturizing can indeed smooth out the scaling, it will only irritate the affected patches and make it look more inflamed. Certain ingredients like perfume or alcohol, which are typically added to most lotions and creams, can actually worsen the dryness. Seborrhea could be a source of embarrassment, especially since many people think it's a sign of poor hygiene or a lack of good grooming. Fortunately, knowing how to treat severe dandruff yourself could help you control this condition so that you can face the world with more confidence than you had before.